Okay, guys, take three. We don't know what's going on, but Rachel and I cannot find each other. So Rachel Dorsey, okay, so maybe this will work better. Hi, Beth. I'm supposed to be interviewing Rachel Dorsey. She's an autistic speech therapist. And yeah, she wanted to share her journey and how she got started, but she's not able to join me. So I'm hoping that, so she's restarting her phone and hopefully she can join us. So I need to be patient. I need to just chill. How is everyone doing? Any plans for the weekend? Anybody doing anything interesting? Going somewhere? So, hey Sam, how are you? I love your poem. You are so good. Are you interviewing anyone interesting? Like, all your guests are interesting, of course. I shouldn't say that because that's why you interview them, right? So, yeah. So I posted your poem to Nurturing Neurodiversity Facebook group. That's a group of parents of very young, tiny autistic children. So I thought it's just so lovely to, I always love helping parents to, yeah. So who's your next speaker? Sam. You guys have to follow Sam Huber. Huber Family Adventure. Oh, yay. There's Rachel. Okay. You go. Oh, finally. Well, thank you. Thank you for writing them and putting them on Facebook. It's really helpful for families, like parents, to be able to see a different insight. Okay, so we're waiting for Rachel. All right. Hi, Maria. Okay. So who's your next speaker, Sam? Okay, maybe Rachel's having like internet issues. Sometimes that's possible too. So I don't know. I apologize, you guys. This is not our intention. Oh my God! No!
I'm so sorry. I don't know what happened.
Yeah.
I just restarted my phone, but earlier, I was here from the beginning and it did not give me the option to. That does not reflect my business standard.
Yeah, no worries, no worries. So we're here. So Josh is here. Josh and I connected through Facebook. Yeah, and Josh is very interested to learn about like our careers, yeah. So thank you for joining me. So Rachel is a speech therapist and she owns her own consulting business. So can you tell us about your consulting business? Like what you do?
Yes, I will. I think the part of the issue is that there's my internet in this room for some reason is not working. So I'm so freezing and that.
No worries. There's nothing
I tried to set up my phone holder.
Yeah, it's okay, and it's also Friday afternoon, so I think everybody's like chilling on their devices, so it's okay.
Okay,
Yeah.
so you're not
better.
freezing.
Yes.
You're not freezing anymore.
Okay, good. You're good.
Can you go back? Yes. And Josh is interested in.
So he was asking me questions about like just careers with kids, like what you and I love doing, right? And he
Yeah.
was asking me what play therapy, speech therapy, occupational therapy, yeah, or just psychology in general. So I invited him to come, so I'm glad he's here.
Yeah.
But I actually started when I was 19 as a babysitter. And then I was working at a preschool as a teacher's helper. That's how I got started, just part-time when I was going to school. So how did you get started?
Well, working with young children. So, I mean, I'll be honest, I had very little experience with young children prior to my first job post-graduate school. And honestly, it wasn't my first choice as far as population goes. I in graduate school really connected with adolescents and older children, and so I wanted to work with that population. But there were no job openings, so I worked in early intervention, and I kept doing that. And at first, it was really hard because I had to both learn how to interact with like typically developing young children and children with disabilities. But I mean, like now a lot of it like comes super natural, particularly interacting with young autistic children. So yeah, it just kind of fell into place. But yeah, I really enjoy it.
Yeah. So I realized that for me, it's not just teaching my clients, the parents I work with, skills, like how to fix things when it comes to their kids, you know, like behaviors and stuff. But I feel like for me, what's in it for me is that I feel connected to my clients. You know, I don't know if you feel like we just feel their vibe.
Yeah, for sure. I would say, I mean, like I would say in particular with my children that are autistic that I see, but even the children that are neurotypical but still have some sort of disability. I am really sensitive to the vibe they give off, and I consider myself a very cautious clinician. I know that as far as like pushing the client more, like if I sense that that the client is, or the child, or even the parent, it has some sort of hesitation or discomfort in any sort of way, I know that it's going to be much harder to keep going and then have it not be like 100% and then have to like back up and repair the relationship and repair everything. I know that going really cautiously is the I mean, for me, it's how I work.
I think okay, so I'm thinking about Josh. So Josh, if you like being with kids, and I think that if do you think that clinicians have to be patient? Is patience a thing? That is it like do we have to have that in our personality in addition to like being an autistic clinician? I think it has a lot of pluses because we can translate for our clients better, right? But what do you think about patience?
I mean, I have so much patience for my clients. And I mean, I would say usually the parents, I don't have patience, or I'm trying to work on my patience with people who kind of just don't really get it.
That is hard. Sometimes I lose my patience too, because I'm very overprotective of like my clients, and I say this all the time. I work for your child because like I just want him to feel respected. And you know, and sometimes that's where I think I can be maybe feeling a little frustrated, but I think we work it out though. I mean, you mentioned relationship. I think that's with any careers, with serving other human beings. I think relationship has to be number one, you know.
For sure.
Yeah. So if you want to be a consultant, so you own your own consulting business. Can you tell us about that?
Yeah, so it's relatively new. I started it over the summer. I moved from New York to Massachusetts this past summer, and it gave me several months of, with that move, I wasn't working. I was moving, and then there's a gap between my new full-time job starting, which is at a small speech therapy clinic in Massachusetts. And, you know, it's like I'm given time to think, and I'm kind of alone in my house, and I'm just like, I'm thinking about a lot of, like, how do I really, truly help the biggest, the widest amount of people.
Right.
And I realized that that path of really educating other speech therapists on working with their autistic clients would really help the most number of children overall. And so I was also thinking a lot about, there's so I mean, I could have infinite blog posts, but there's so many things about autism that clinicians, neurotypical clinicians, don't understand. And when you don't understand, when you don't see the why, you can potentially be doing harm. And that really bothered me, because I've seen that done. It's like, because you're not autistic, and I'm autistic, by the way. I don't know, she probably said that already. I'm autistic. And because you're not autistic, you don't know what you don't even know. And that leaves a lot of room to learn. And so my consultancy really grew. I wish I had like a really fluffy, positive like story, but it really grew out of like, I have so many thoughts. I'm really passionate. I need to somehow like get this out there, because I don't like seeing autistic autistic kids appear to be happy maybe in the moment,
right.
but then, 10, 15, 20 years later, have some bad outcomes.
Right,
so.
right. So I think educating your peers through your blog posts, it's really important. I mean, that is, so when I worked as a behavior therapist out of school, I did work for a clinic and work my way up as a clinic supervisor. And it was really hard to work for someone else, so you had that experience too. And I'm asked all the time, should I work independently or should I like work at a clinic? I mean, if you can find a clinic who can like guide you and help you develop as a clinician, I think that's awesome when you're fresh out of like graduate school. So, but so hopefully people can find that would be a good first stop, I would say. What do you think?
I mean, so that's something that my boss and I have been talking about a little bit. Like the clinic that I currently work at, its focus isn't on autism. Right. Its focus is on like a very specific kind of subset of speech therapy where actually dentistry and speech therapy kind of overlap. So it's very different, and it's very interesting, and it's a completely new thing for me, which is why I was drawn to it. But we're also finding, very surprisingly, that a large, maybe not a large, but a subset of clients that we're seeing, like her background isn't in autism. But it's very intuitive to me, and I it's like the autism radar type of thing, and I can sense it. And there's been this crossover that was surprising to find. But we've talked about a couple of people have contacted me like through the consultancy that do live in Massachusetts, and so I gave them the option to do like a parent coaching or to become a client of mine in the very small clinic I'm in. So I do have a couple of clients that are autistic, and that's like the thing I'm like the needs according to that I'm working on. But my boss and I have talked about like me potentially like taking on another like a SLP and training them specifically regarding autism. And then advertising to the community like we do this speech therapy plus dentistry thing. But then also we're really strong in autism, and like then we would get a lot of referrals, and then like we've talked about it. But
so you found a place to work with that allows you to grow, so it's more like a partnership, and that's really ideal. I didn't have that, so I actually reached like to the top because I was a supervisor, but I ended up working like 50, 60 hours a week. And many nights, I'm not kidding, my head was down. I was in tears. Like I wasn't able to work with the kids anymore because I ended up doing other stuff, logistics, and yes, I was training therapists. I was like just doing all this stuff. And it really took away from what I wanted to do in the first place. So that's important for like new clinicians sometimes. Like you just don't know if the place you work with actually limits you. And I didn't follow my gut instinct, and so I finally left and do my own thing, which was great. And then I got certified in RDI, was able to do this, do that, but it was scary to also do things on your own, you know.
Yeah, it is. I guess I mean, honestly, like my situation was very fortunate in that I'd already secured a full-time job.
Yeah.
I feel like my boss and I really, it's just me and her, and we do get along very well.
Yeah.
And she's like completely open to everything I have to teach her. I'm learning things from her on her specialty. So, but then I was also free to explore a new type of to start my own, my own business.
That's great.
So it was very fortunate, and I recognize that you know, if you're someone who I mean, like, it sounds from what you're telling me that your situation of just like being so like, I'm so far removed from what I originally wanted to do. And that seems like emotionally like a more difficult situation to like make that big jump. Whereas I kind of had more of a luxury of like,
you were lucky.
Well, if this works out, like great. And if it doesn't work out, that'll suck. But I mean, whatever.
Yeah. So let's go back to our training at school. So psychology took 4 years. And then you, speech therapy, how long did you go to school for your
So I went to University of Florida for my undergraduate degree. I did undergrad. It's actually like they're separate colleges within the university, so I had 2 degrees technically. I did linguistics. And I did communication sciences and disorders. And communication sciences and disorders is like the pre-SLP undergrad degree. And so then I went to University of Madison, Wisconsin, University of Wisconsin-Madison for grad school, and that was a master's degree, 2 years. And then in speech therapy, but not like OT or PT, they have you do this weird year called a clinical fellowship, which is like you're a speech therapist, but you have a supervisor.
And it's your field work, basically your supervised work.
Well, it's like, no, because then in graduate school you have your field work. You do like get that experience and have a supervisor. I would call it closer to like a residency in medical school. But not as prestigious. But like in concept, that's the closest thing.
So for me, I graduated from UCLA with a degree in psychology. And I just started working as a behavioral therapist with this agency, a very large agency. And I just kept learning, I suppose. And I didn't need to get my master's degree until much, much later. So for our autistic followers here, if you guys are listening here, as long as you enjoy working with this population, I think a good research would be just like try babysitting, try working as a preschool assistant, try to figure out what age group, what directions. Like not everyone is comfortable like doing play, for example, like getting on the floor, like playing with kids. That's not you know what I mean? So,
but I will add in, so there's like a small-ish, like 80 people Facebook group of autistic speech therapists.
yeah.
And although like some of them, including myself, like work and like really are driven by working with autistic clients. A decent number of them work with adult populations, not autistic adult populations, just like hospital, nursing home. And it's very interesting because they have reported you teaching these adults who had like a stroke or a traumatic brain injury or dementia, teaching strategies that they themselves use for mild executive functioning or language or this or that type of thing. So like really like autistic like strengths, and also like the ways that you find to kind of accommodate yourself, like strategies that you've found that really work for yourself. If you are interested in working with other people, it can be like clinically, it can be with a range of populations, because I'm sure due to our natural pattern finding abilities, we'll be like, oh, I see how this client is having difficulty regarding like, this sort of thing. That is very similar to how I have difficulty with this sort of thing. I can try teaching that method.
Yeah. So you're saying that we're intuitive.
Yes.
We are intuitively, I think that I could totally, I agree with you, and I think working as, being self-employed has been the best for me. I can have flexible schedule. I could work. I could take a week off. When I was single, so it's a really good job. Actually, I think working with kids, say you get your degree in psychology or early childhood education, like an A degree or your BA, and you just go out there, there online tutoring stuff that you could do to just kind of experiment before you decide, okay, I want to do feeding therapy, I want to do, so I think that's a good time to like explore and then thinking which specialization you want to do, just to make sure.
I in undergrad, I did a lot of observation and volunteering within education, speech therapy, OT, and audiology.
Yeah, there you go.
And so, and then like I obviously I made a decision, and you never completely know if it's the right one, but you kind of went with my gut.
Yeah, exactly.
So, exactly.
But I think doing what we do has been amazing. Like there's always what's next for me, whether it's teaching, like designing an online curriculum, like working with teachers, there's always, I'm able to travel to do presentations, which I love.
Oh, that's awesome.
I don't think I can get my
working myself up to that.
I'm gonna take you with me.
That would be amazing.
Once COVID is done,
once COVID's done, travel.
Yes, but so you guys, for people here, I mean, we have a couple of people here, but I don't know if people have any questions. Do you have any questions about speech therapy, working as a psychologist, self-employed, and we don't really have to raise any capital. I I did have a clinic actually, which I let go because I was never there. I just
Mm-hmm.
work from home, you know. So I think today clinicians like us, we don't need to have a physical space. It would be very expensive to do that.
Yeah. I think so. There's one thing I do want to say.
Mm-hmm.
I think this is, I think can be applied to just about any
Mm-hmm.
like speech,
Right.
OT, PT,
Right.
psych. I think like that kind of
Yeah.
job.
Mm-hmm.
So like I said, I have the consultancy and I'm also
Mm-hmm.
employed by a boss
Right.
in a private practice.
Right.
And I figured out
Mm-hmm.
very, very quickly
Mm-hmm.
after graduating
Mm-hmm.
that working in an environment where other people are constantly like stressed all the time,
It's not good.
and yeah, that
Mm-hmm.
is not good for me. No, that's just
No.
awful.
Yes.
And I figured out that, like, initially
Mm-hmm.
upon graduating, I really wanted to work in a school because I had a great experience
Yeah.
in my high school placement and graduate school.
Mm-hmm.
Um, and I'm not trying to, like, there are great school districts
Yeah.
out there, and
Yeah.
like your personality might be a great match. I just figured out through
Mm-hmm.
doing early intervention where you still need to
Mm-hmm.
interact with school districts
Yeah.
that like it was not appropriate for me, and so
Mm-hmm.
I was able to find out like what works best for me
Yes.
is a very itty bitty little private
Yeah.
practice where I have a boss
Mm-hmm.
who, I mean, like, I realize you can't always have like a very supportive boss.
Yeah.
I really became very lucky.
Right.
In my last job
Mm-hmm.
and my current job with
Yeah.
to have bosses that were very supportive and wanted,
Yeah.
like really emphasize creativity and like,
Yes.
you have a project, let's try it out and see how it goes.
Right.
So uh I think that knowing you can be an OT and
Mm-hmm.
work in like so many settings.
Yeah.
You can be a psychologist and work in so many settings,
Mm-hmm.
or work at home,
Right.
or like
Yeah.
there's a lot of
Yeah.
flexibility.
Yeah.
And even if right out of school,
Right.
the thing that you
Yeah.
have doesn't really
Right.
like it causes you a lot of anxiety or
Yeah.
stress,
Yeah.
that doesn't mean that the field is wrong for you. It
It's the
means that
environment.
like
Yeah.
that setting and the
Mm-hmm.
people are wrong for
Yeah.
you.
Yeah. No, that's what I went through. And it got better after I left and just started
Yeah.
figuring out, what's meaningful to me and in what capacity. And it was great. I made more money because, I set the rate. It was great. I can
Uh-huh.
work Monday, Wednesday, Friday. I don't have to work on weekends. And today, actually, people have more options because of telehealth.
Mm-hmm.
So I think for people who are here, if you're interested to learn about how to do group online classes, I'm your person to ask because I do a ton of that. I love to travel and to do presentations. I'm very good at finding gigs abroad, like what country you want to go
Oh, wow.
to. LinkedIn
Awesome.
is the way to go. So if you guys have
Yeah,
any questions, yeah,
I wanna like go to school districts and like,
yeah,
and like really like make people question things that they've been doing for
yeah,
a really long time, and then
yeah,
provide a framework
yeah,
that just is more supportive.
yeah.
But
Well, we
my thing is young.
but
I'm
we
working
could
up
do
to
it
it.
together, so we can co-present together. Like I can
And,
explain what, like I could explain the like redefining atypical or redefining autism
mhm.
definitions, and you can co-present the communication part and how that develops
Yeah.
and why it's different. You know, it's not
I mean,
that.
that would be
Yeah,
awesome.
so we could do that, and that could be our thing. And I just get burned out if I repeat stuff. Like, my thing is to create a curriculum and then tape it or teach other people to do it, you know, because I'm sure you want to have more time to write, to do this and that, you know what I mean?
Yeah,
Right?
My friend and I are working on a course for a kind of about redefining social skills, particularly within very young autistic children, or not very young, like maybe, well, actually, you know, we are starting from birth until like 8, 7. But there's been a little bit of a pause because my friend actually got COVID.
Oh no.
So yeah,
it'll continue.
It's not good.
Yeah.
But we'll I mean, when she recovers, we'll keep at it. But
so I think our message to our followers and listeners is like, if you are interested in this field, working with like neurodivergent people of all ages, just do it. We can support you, connect you with other similar minded people. And it's a really good profession. Like, look at me, I've been doing it for 30 years, still doing it. So it's good. I enjoy it.
I've only been doing it for 4 years, but I'm trying to make my footprint, and I'm excited to see what happens next.
You're just getting started. So send us your questions, and if you have any questions, you can text me. I don't think people have any questions. We have, they'll have questions later. So Rachel, thank you so much. Have a great weekend.
Thank you so much for having me. As always, I appreciate it so much. And you're so good at, like, at the end, like, we talk, and then you have, like, central message. And I need to get better at, like, talk, main idea.
Well, I just need because my mind wanders. So when I hear people talk, I try to just take a couple of words and then I kind of recap it. It's mostly for me because
it's a strategy.
It's like a bookmark for me.
Yeah,
so
that's
you know what I mean? So okay.
I'm trying to get better at that strategy.
Yeah, but you can interview me to practice. That's harder. It's hard. Like, if we reverse the role, it's a lot harder for me. So
I know. I bet I would not be great. A lot of practice, a lot of scripts written.
But it's fun. It's really fun to hang out with people. I like it. Okay. It's so helpful as well, but it was overall super informative. Oh, yay! Excellent. Thank you so much. That's what we're doing. Thank you. Okay, guys. Happy weekend. Take care.
Okay, thank you. Bye.
Bye.